welcome to Picture of Health. I'm your host, Stephen Barnes. On this month's episode, we are diving into learning about the condition that is very common but misunderstood, arthritis. Arthritis is inflammation of one or more of your joints, and its main symptoms are joint pain and stiffness. Today in studio, I'm joined with Dr. Juan-Carlos Martinez, who is from the Winter Haven and Lakeland Medical Centers by the MBMG. Thank you for being with me today, Doctor.
Thank you for having me.
Now, before we dive into arthritis, I'm always interested to know why doctors become doctors. What made you decide to go into this field?
Well, me particularly, and I know most of my colleagues, is because we want to help people.
Right.
From an early age, most of us either have someone that's been a doctor in our family, or at some point we have come across an experience, we've seen something, heard something in the medical field, even family members, and that's when it clicks and you decide, this is what I want to do. I want to be a doctor.
What was it for you?
My great-grandmother was bedridden, and it was desperate to see at 12 years old and not being able to do anything about it. And that's when I decided I want to be able to do something.
Yeah. Now, where did you study medicine at?
Puerto Rico.
Okay.
Yeah, did all my medical studies there.
Very good. Very good. Well, let's talk about arthritis a little bit. You know, when people think of arthritis, they probably think of the person they know who has arthritis. And
Absolutely.
so they think of that type. But there's actually a lot of variety, different types of arthritis. Kind of explain what it's all about.
Sure. We can group arthritis into 4 major groups. One is the wear and tear arthritis, which most people are used to seeing most of older people get. The other is inflammatory arthritis, which is mostly autoimmune, when your own immune system starts attacking your own body. Thirdly, metabolic arthritis. Most people have heard of uric acid, one of the substances that's a breakdown of proteins that we eat. And if it accumulates, it can cause symptoms of arthritis, joint pain, joint swelling, so on and so forth. And then infectious. There are some bacteria, some fungi, some viruses that can attack the joints specifically.
Okay. What are the most common types?
Like I said, wear and tear arthritis. As we get older, the cartilage, like you mentioned, in between the bones just wears out. The bone starts grinding against the other bones. That causes inflammation, swelling, pain, and that can get worse over time, over the years. Sometimes it doesn't, but if you're doing repetitive movements, if you've had some trauma, that can cause it to accelerate.
I mean, if this is something that, you know, increases with age, the symptoms increase with age, like how many people are affected by arthritis?
Wow, that's millions of people, adults particularly, but even children, about 300,000 children in the United States.
Really? Yeah, you don't typically think of children with arthritis. That's surprising.
Yeah.
Now, you had mentioned some of like the pain and the inflammation, but what are some really common signs of arthritis? What are some of the symptoms?
Yeah, signs are seeing things that you can see in the body. Symptoms are what you feel. So signs of arthritis, there's not that many, but it depends on what kind of arthritis and if it attacks other parts of the body. So in terms of the joints, you can have swelling, redness, little bumps, but it also can affect the skin, other organs like your lungs, your heart, your eyes, and then you'll see things that are particularly or specific to those organ systems.
So somebody who might be having issues with vision,
it could be arthritis.
Cause could be arthritis.
Yeah. If they have the other symptoms of joint pain, stiffness, so on and so forth.
Who would have imagined? When you deal with you know, stiff joints and things like that, how is it? I mean, you know, let's say you're exercising, you're working out, and things like that. How do you tell the difference just between I feel a little stiff and sore and like an actual problem with arthritis?
If it's wear and tear, you'll notice that as you repeat the activity it tends to get worse.
Okay.
Exercise is excellent for arthritis, but if you're not doing the right exercise, or if you're doing some other activity at work, at home, then it can affect the joints adversely. So you'll have worsening pain, worsening swelling, those kinds of symptoms.
Now you said there were 4 different types. So
yep.
We're kind of talking more about the gradual wear and tear. Tell me a little bit more about the dietary kind of arthritis. You said the proteins that we take in can affect arthritis.
Correct. Most of our diet, most people eat some kinds of meat, and protein is a big thing in our society. We hear all the time we should steer away from carbohydrates, it affects blood sugar, you should eat more protein, which is true.
Right.
But then again, depending on if you have a family history or your genetics, then your metabolism might not work the same and your ability to digest proteins might not be as adequate. Then you can get an accumulation of uric acid, which, like I said, is just a breakdown from the proteins. Then if it accumulates in the joints, it forms needle crystals, which cause pain, swelling, stiffness. It can come and go. People have heard of gout attacks. That's usually pretty common. Or it can just stay there, become chronic, and just deform the joints.
Okay, so what we're talking about is kind of, is it gout or is it just like gout?
It is
gout.
Gout
Is a
it is
form
gout.
of arthritis.
Yes, it's a form of arthritis.
Okay, very good. Now the other types of arthritis, you had mentioned, I can't remember it now. What was the second one that you said?
Inflammatory and infectious.
Infectious, yeah. How does one get an infectious arthritis?
Type of arthritis?
Yeah.
Well, infections you acquire usually from other people or animals. Fungi specifically, usually from plants or working on the outside, sometimes from sick buildings. And those can attack different parts of the body. Usually you acquire them through the respiratory system or digestive system, and then it can move through the body to your liver, stomach, and eventually the blood and the joints.
Right.
It sets in the joints and starts causing inflammation. Your body is trying to get rid of the infection is trying to win that war or battle, and that's when you get all the inflammation symptoms. Then there starts the pain, the swelling, the redness, and all of those other symptoms.
Now, these 2 types of things are really treatable. I'm assuming the infectious and the dietary things, they're simple things to adjust. How do you determine, somebody might just think, oh, well, I'm getting some arthritis because I'm getting old.
Sure.
My joints are wearing out a little bit, but it could actually be something that's easily adjustable for them. How does somebody know what route to take?
Well, the most important thing is if you have the symptoms. It's something that's not normal. You were feeling one way one day, then the next day you're having something that was not there, whether it's the pain or the swelling, or you're not feeling well, just in general. You're feeling sick, tired, fatigued. So that's when you decide, this is not how I usually feel. I may want to get this checked. I may want to see a doctor or someone that knows a little bit more and get this examined.
So when somebody goes to you and they say, hey, I think I've got some arthritis going on here, how do you diagnose arthritis?
Well, basically the most important thing is the history. How old are you, gender, genetics, is there anything that runs in the family? And then of course the physical exam. Do we find redness, swelling? Where does it hurt? Is it on both sides, one side only? Is it one joint? Is it more than one joint? And putting all that together, plus some tests to either eliminate infection or rule it in, and find out that it is indeed an infection, whether it is an autoimmune condition and your immune system has just gone haywire, and it's attacking you.
And so that's why it's important that if you see any symptoms of arthritis, to get to a doctor and let them check it out.
Absolutely.
So, doctor, when they come to see you, you diagnose them with arthritis. I mean, is this kind of like, well, you've got it and that's it, or like we talked about some of the dietary things that you might be able to do. Is there something that people can do to lessen their chance of getting arthritis, or to even just lessen the symptoms?
Absolutely. And one of the most important things is to stay active. Now, like I said, we have to determine which kind of arthritis it is. Okay, if it's an infection, then definitely you need medications to placate that infection to get rid of it. And that'll definitely, the sooner you address it, the more likely it is that you go back to normal. If time goes by, you haven't dealt with it, then it might become chronic. And even though we might be able to get rid of the infection, you'll still have some of the symptoms resulting from that. Now, if it is just the wear and tear arthritis, staying active is one of the most important things. Keeping a healthy weight is extremely important to not put additional stress on your joints. Avoiding repetitive actions, people that are all day long on a computer, on a keyboard, people that work in construction, lifting things, so on and so forth.
Now, I understand that you guys are doing a special minimally invasive procedure there at MB Medical Group, and I'd like to talk about that in just a few minutes when we come back.
Absolutely.
That's all the time we have in this segment, but we'll be right back. Stick with us with more as we come back with Dr. Martinez.
Maybe I have that?
Oh, thank you. Did you see anyone drop us?
You moved there?
Thanks for helping us.
No problem.
Is this your bird? You're welcome.
We'd do anything for kids. Yet 1 in 6 children in the U.S. struggle with hunger. Help end childhood hunger near you. Learn how at feedingamerica.org.
We all know that we need food to survive. You remember how Mommy showed you how to do it? We really strive to provide the necessities for our families, but many of us, we fall short. I remember the first day I walked in the food pantry, I really was afraid. I was embarrassed, I was humiliated. I worked every day and I worked hard. It's difficult when you're trying to feed 3 children and you're only receiving $23,000 a year. It took a very long time for those negative thoughts to change, and I walk now in the food pantry and I have friends. It takes me a lot longer than it should because I'm eager to talk to people. When I see people hurt, for some reason I hurt too, and I want to reach out and hug you. You'll be so strong in the end. Just know you're in a good place right now. This is a good place to be. I'm a school health aide. I take care of people's children that are sick or injured until they get back home. I just care for them like they're mine. I love what I do. I get up every morning, optimistic, energetic, with a smile on my face. I just don't get paid very much. I live here in Alexandria with my husband, Cornell, and our 3 children. You wanna eat this tonight? You make like tacos or something? My first job is a mom. Come on, Colin, let's go out and check out the greens. You wanna water them? My children make me happy. In this community, there are a lot of people who are struggling day to day to just live. Simple things like food. I love life, and making sure that my children are happy and strong and good citizens makes being a mother even more worthwhile.
Well, I mean, as a kid, my parents always taught me that we needed to rescue pets.
You know, adopted dogs and shelter dogs, they're so appreciative and they're so loving and they're so beautiful.
Lily here is our queen of the house. She's just been the best little nugget. Foster, he is the athlete, so fetching is his big thing. Dingo, he likes a good massage. Every few days, I'll give him like the best, like 30-minute amazing massage, and he just
Melts.
Yeah, melts. We knew that we wanted our dogs on our wedding from day one. So when we planned our wedding, I was just so excited to be able to incorporate them into it. And watching them walk down the aisle was just so meaningful to both of us because they are our kids. And to be able to share that special day with our special loved ones, I don't know how we could have done a wedding without them being there. Shelters are great. They do such a great job at these shelters in making sure that they're healthy and they have a wonderful place to sleep and it's well lit. Shelters are fun to go to.
Another big plus with shelter dogs is so much of the work is cut out for you when you get this dog. I mean, all these dogs, they're microchipped, they have their shots. You're starting off at such a great point with your dog to move forward.
And truly, I've never been so happy than I have been.
Well, apart from being with this guy, being with these dogs, like truly nothing makes me happier.
Like literally when we're out, you know, at dinner or with friends or even if we're traveling, all we can think about is getting back to our pets. If you want to smile every day, adopt a dog. These are our shelter pets, Foster, Lily, and Dingo, and they are amazing. And you can find your amazing shelter pet at theshelterpetproject.org.
Welcome back to Picture of Health. In case you're just tuning in, we are learning about arthritis this month with Dr. Juan-Carlos Martinez from the Winter Haven and Lakeland Medical Center run by MBMG. Doctor, we were talking in the last segment about some of the ways that folks can help themselves out with arthritis, you know, continuing to stay active, reducing weight and stress on the joints. Now, once they have arthritis, it's there.
Yes.
You're doing some things that there at the medical center to kind of help mitigate this. Tell me about what you're doing with your patients.
Sure. As always, we always start with conservative treatments, and that's the best thing. If we can avoid invasive procedures and surgery, that's what we want to do. So what are alternative treatments or conservative treatments? Well, we can start with something as simple as massage, exercise, physical therapy, heat therapy, cold therapy, all of those things. At our clinics, we offer all of those. We can diagnose you, and then we can decide on a plan of treatment, what best suits your needs.
Now, I'd imagine for some of these, not every case is the same, so you're going to have people that respond better or worse to certain treatments, right?
Sure, absolutely.
What do you find for some of these very minimal basic treatments, some of these therapies, what do you find that seems to be the most effective?
Massage and exercise.
Yeah.
And you can learn to what kind of exercise to do at the clinic and then go home and practice that.
And I'm sure, as with a lot of things, doing the exercises the proper way, the right form, is what's going to keep stress off of your joints.
Definitely, definitely.
Yeah. Now, beyond some of the basic things like the therapies and things like that, what types of things do people have to get into once the arthritis becomes a little more severe?
Yeah. Once those conservative treatments are not enough, then we can offer joint injections. Now, you've probably heard about cortisone injections. Majority of the people have heard of steroid injections in the joints. We offer a joint injection that is not steroids.
Non-steroidal.
It is, non-steroidal. It is the own patient's plasma. So we take a vial from the patient's blood, we centrifuge it, and that's to separate the platelets, which are the cells that are in charge of the inflammation process. So basically we're putting in the joint your own cells to help recuperate through inflammation the health of the joint.
So there's no foreign bodies in there or anything
Exactly,
like that. It's
exactly.
all what's already there. That's interesting. So these are to help decrease the inflammation around the arthritis then?
It's to decrease the damage.
Okay.
Initially, these cells, like I said, are in charge of inflammation. Inflammation is nothing bad. Inflammation is just the process through which the body fixes itself, so to speak. So when inflammation goes out of hand, it causes problems. Destruction starts. But the intention of inflammation is actually to heal, to repair.
So when you talk about the more traditional things like the cortisone and the steroid shots, are those directed at the inflammation then?
Yes. It's when inflammation takes over, like I said, it doesn't stop. The body is trying to fix itself and it can't. It just continues
so it just keeps
and continues.
creating more inflammation.
Exactly, and destroying the tissues. And then a way to decrease that or stop it is through steroids. Now, repeated steroid injections actually go and cause atrophy of some of the tissues. Then the body cannot repair itself
As well as I'm sure a lot of other side effects that come along with the
Exactly.
steroids. Now, so the plasma injection that you're doing, it's not actually directed at the symptom of the problem or the result of the problem. It's actually directed at fixing the problem.
Exactly, exactly.
So you would have what? You would have two bones in a joint that are rubbing.
Exactly.
And so you're injecting that plasma in between those two joints to create some separation. Is that?
One of the things that we do is called PRP, which is platelet-rich plasma, in which we inject the patient's own cells, own blood, own plasma into the joints that are affected to help rebuild the joint.
Okay. So this plasma-rich, wait, how did you say that?
Platelet-rich plasma.
Platelet-rich plasma that you're re-injecting, the patient's own cells are actually rebuilding that cartilage that is wearing down. That's incredible. Now, this procedure, you're performing this at both of your locations?
Yes, we are. Yes, we are. We have specialists that are trained to do those injections, and the support people that will make sure everything's ready for when that procedure is to be done.
Okay. Now, with traditional cortisone and steroids and things like that, pretty much no downtime for recovery. You might take a day or two to really see the effects. What do you see with the platelet-rich plasma injections? What do you think?
Usually, it's not only one injection. We use 3 injections, 1 a week for 3 weeks.
Okay.
So, like with any injection, you're going to have some worsening of the pain over the next 24, 48 hours. But by the end of the 3 treatments, you should be feeling less pain, be able to move your joint more freely and without symptoms.
And that's what everybody's looking for. Yeah. A lot of folks, especially as they get older, they become less and less mobile, sometimes even from arthritis. They just can't get around like they used to be able to. Making it to doctor's office and getting doctor's visits can become quite a chore. You guys at the medical centers, at Lakeland Winter Haven Medical Center, you have something to kind of help out with that. Tell us about your mobile unit.
Yeah, the mobile unit is just basically a clinic where we can do all the things that we do in a traditional office. In this case, instead of you driving yourself to the office, then we'll get to you. We can do exams, interviews, treatments, perform treatments, just the same as we've been talking about. If it's best for you, we can actually go and pick you up at your house. We have transportation available and bring you to our clinics to receive those treatments.
And that's huge because, I mean, here in Polk County we have some services that are available for folks who are handicapped or, in their scooters and things like that, who are not as mobile as what they used to be. but oftentimes it's very difficult to schedule those services and things. So it's great to have a doctor's office that cares about their patients enough to actually get them from point A to point B to get them taken care of. That's really great. When it comes to arthritis, what are some of the big misnomers, some of the big misinformation that's out there about treatments or just about the condition in general?
I'd say the most common thing that people think is, I'm getting older, I'll get arthritis, there's nothing I can do. That's the part that is a misconception.
Yeah.
There's always something that we can do to alleviate the symptoms, to stop the progression of the disease, to get you back to an active lifestyle.
Right. And that's the biggest thing. You know, I think about my parents as they're getting older, and you know, joints are not working as good as they used to, and nobody likes going to the doctor. I mean, let's face it. You're terrific.
Yeah.
You're a great guy, but nobody likes going to see the doctor.
Sure.
But making sure that you get in and see a doctor as soon as you can is the best way to create a plan for reducing the disease.
Yeah. One of the things is, don't wait. If it hurts, if it doesn't look right, if it doesn't feel right, please come and see us. Come and see a doctor. Come and see someone that can tell you a little bit more of what's going on, figure it out, and create a plan.
Now, doctor, when it comes to arthritis, we mentioned a few things, you know, about exercising and reducing your weight and things like that. As is with a lot of medical conditions, it's not just that one symptom
Absolutely.
that is causing the problem, and it's not just that one symptom that you have to treat to make things better. Tell us about how you kind of take a whole health approach to treating arthritis.
Absolutely. My training is as a family doctor, and most of our doctors are either family doctors, internists, or specialists in, you know, whole health. So we can address your comorbidities, which are those conditions that are associated with or that we get as we get older. Heart disease, lung disease, diabetes, which is a big one here in the United States, high blood pressure, etc.
Well, you know, it's nice because here in Polk County we have, obviously, it's a great place to retire. We have a lot of elderly citizens. So it's really nice to have some doctors specializing in conditions that really kind of see themselves show a lot more in that elderly population. And it's good to know that you're here. How do people get in touch with the Lakeland and Winter Haven Medical Center?
Sure. They can call our number. It's 863-821-0021, or go to our website, www.mbmedicalgroup.com.
Perfect. Well, doctor, this has been an absolute pleasure, and I'll tell you, the information about arthritis is very pertinent in our area, obviously, and it's great to know that there is procedures that are minimally invasive that people can go and help to better their life and create a better quality of life for themselves.
Absolutely. Thank you.
Thanks for coming on. Appreciate it. Unfortunately, that's all the time we have for today. If you'd like to watch this episode again, you can catch a replay on Tuesdays, Thursdays, and Saturdays at 2 or 8 a.m. and p.m., or find us on the Polk Government YouTube page. I'm your host, Stephen Barnes. Tune in again next month for another Picture of Health.